Good morning. Picking the Channel 7 Newsmaker of the Year is never easy. The list of potential candidates come from all fields of endeavor. Normally, it's one individual that captures Michigan's attention. But 2020 was very different. The unexpected COVID-19 pandemic took the world by storm and turned our lives upside down. So for 2020, our Newsmaker of the Year is a representative group of essential frontline workers who stepped up to the plate when we needed them most. So sit back and enjoy my Zoom panel discussion with 10 of Michigan's real heroes. We began our conversation with a very simple question. Do they think of themselves as our COVID-19 heroes? I'm Chuck Stokes, and this is our Spotlight Newsmaker of the Year special for Sunday, January the 17th.
No, I don't see myself a hero. I was just doing my job, doing the right thing.
No, I also didn't feel like I was a hero. I'm a physician. I'm just doing my job.
So I don't consider myself a hero as well. I just try to make an impact as much as I can and do my job as I've been doing before.
Yes, again, I think we're just all doing the job that we've called to do to teach these children.
No, I agree with everyone else. I don't see myself as a hero at all.
I see many heroes out there, and I don't consider myself one of them.
Absolutely not. This is a calling for me, not a job. So yeah, absolutely not.
No, I agree. Just doing what we needed to do to take care of patients.
I've never viewed myself as that. I just come to work and do what I love to do every day.
This is truly a calling, and we are truly serving and protecting and serve what part of our mission is.
Looking back, what has been the biggest challenge? And do you feel as though things are a lot better now and you sort of have it under your thumb? I'll begin with you, Dr. Swederick.
Oh, I think the biggest challenge in the spring of last year when this all started was the rapidness with which the patients came, the volume of patients we had to take care of, and really the swiftness we needed to change what we did on a regular basis. PPE was a concern, but our health system did a good job of getting PPE to us kind of in the nick of time. Over the summer of last year, we kind of saw a lull in the number of COVID patients that we took care of, and then it started to increase again this past fall. And I think the challenge this time around with this second wave, if you will, is really keeping the community engaged, and that COVID fatigue is truly setting in for a lot of people. So keeping them engaged in that social distancing and wearing a mask. And that's been the thing this time around that we've really struggled with.
Looking back, we came in and we, stepped in and just kept doing. We were just in that mode of doing and faced every challenge that came across every day. And with the best of our ability. And, we didn't almost comprehend everything that we went through until that summertime that we had that lull to kind of debrief and look back at all the things that we had gone through. And, we just kind of kept pushing ourselves forward. And then this summer we really analyzed and starting to put forth that healing process for ourselves as we go into this second wave.
Sure. All right, we're going to take a real quick break. When we come back, we are going to hear from the rest of you about some of the different challenges you face and where do we go from here with this very strange year that we just got through. We'll be right back. Don't go away. Let me pick up with some of the Michigan medicine folks. Rhonda Lee, you are a visiting nurse, so you actually go into the homes of patients, and many of them have been COVID patients. That has to be an absolutely excruciating experience.
A lot of them, especially with this second round, they are very ill because the hospitals don't have room for them. So the ones that don't need to be on vents and don't necessarily need to be hospitalized, they're at home. So we're going in and seeing them at home and kind of making sure things are going okay at home. And these people are pretty ill, you know, but, you know, you still have the unknown. So some homes we go in and there's other family members there and you don't know if they have it or don't have it. It's kind of hard being in the home. It's more controlled in the hospital, I feel like.
Sure, sure. And you've been involved in this work for about 30 years, I understand?
Yeah, between Henry Ford and U of M, about 30 years.
Okay. Elizabeth McLaughlin, you're on front lines in a different way. You didn't have to do all the masking up and everything, but you crunch the numbers, you do the data, and you work with all of the different hospitals getting that information. And without this information, we wouldn't have known where in the world we were in Michigan with all this. Is that a good summarization? But you can do a better job on it.
Sure. Yeah, so I co-lead a quality improvement initiative that's funded by Blue Cross Blue Shield of Michigan. And we actually put together a whole registry across 40 hospitals in Michigan focused on COVID patients. Luckily, we already had an infrastructure in place to do that, but we actually were quickly able to get data across 40 hospitals in Michigan to kind of really understand where the areas for improvement were and how we can treat and kind of take care of these patients. So we really learned from the first surge to help us during the second surge now.
It's always a real struggle for our patients. Many of our patients still struggle for resources, transportation, as you mentioned, supplies for their wounds, medications. It's always a struggle for our patients to find resources. Earlier on, we recognized the need to get some PPE into the COVID epidemic. So we reached out to local vendors, international vendors to help us find supplies for our patients. And so after a series of phone calls and meetings, we were able to secure over $200,000 worth of PPE from international vendors. It was amazing. We weren't able to find supplies stateside. We called every stateside vendor we could find. And so eventually our efforts led us to reaching out internationally. So I got on the phone with Korean vendors, Chinese vendors, and, you know, again, through a series of calls and meetings, we were able to secure over $200,000 of PPE and supplies for Detroit area citizens. From that point, we connected with other community-based healthcare centers. So we worked with the FQHC network, we worked with other primary care organizations, and we distributed PPE throughout the entire system. So we're really proud of that. It was something that, you know, took a lot of hard work and a lot of phone calls and late nights on the phone with Korea at 2 a.m., but we were able to accomplish that for the Detroit area community.
Good for you. Dr. Tiffany Sanford, what are you proudest of as you look back on 2020?
You know, I think for me and for my organization, the things that we were proudest of is that we were able to transition so quickly when things were, the state was shutting down. You know, for our patients, as Dr. Farrell mentioned, it's often very difficult, even during normal times, for our patients to access healthcare, you know, due to transportation and financial issues, et cetera. And during this time, you know, my organization and other FQHC organizations were able to transition very quickly to still be able to provide care to our patients remotely via telephone visits, via video visits. And I think that that's probably the thing that we are definitely the most proud of.
Absolutely. All right, we're going to take another quick break. When we come back, we want to hear from some different frontline workers, the first responders, and what about those who have been dealing with our students and trying to make sure that they didn't miss a beat in the middle of the pandemic. We'll be right back. Marcus Gant, you're an EMS worker with the Huron Valley Ambulance. Your frontline experience had to be a little different than what we've heard so far.
Yeah, Chuck, a lot of people have been really nervous to go to the hospital, you know, rightfully so. So they've been waiting a lot longer to call 911 as opposed to when they're first having these onset of symptoms. So by the time we get to them, a lot of them are in severe respiratory distress, or their issues have escalated a lot further than when they normally would have first called 911.
Yeah, this had to be tremendous pressure on you and your colleagues.
It was, but I mean, everybody, I mean, our whole society is joined together, and we've all fought this together. It's not a single group that's doing more than anybody else. It's everybody's come together, and that's, I think, been the biggest help through this whole thing, is the camaraderie of everybody joining together and really doing what's best for our society.
And then I'm hearing now that you're being asked possibly to start giving some of the vaccines, and that you are just exhausted at this point, that you're catching it on both ends.
We are, but I mean, in the long run, it's going to be very helpful. We've been helping at different clinics to administer the vaccines, and we know it's going to be what's best, and it'll be a huge payoff at the end.
Sure. Commander Kyra Joy Hope of the Detroit Police Department, what was your experience? I hear that either you had it or was in your family, and you're on the front lines defending our community.
Yes, absolutely. I was probably one of the first ones to have the virus. It lasted from March until almost June for me. So to be here today, I'm very grateful and thankful. And I think the hardest part for any law enforcement personnel is really that personal community interaction, and that we truly have to educate first on what we're learning from the virus, and to be able to distance ourselves. And I know a lot of us struggle with that because we're so used to really jumping in and being very personal about how we react to our community members. And so I think that was very difficult in the isolation period. For myself, was very, very difficult. Back in the Brothers in Blue, as we say, and you look around and you're all isolated by yourself. So I can imagine how others must truly feel when you have no one around. And just an amazing brotherhood that we have, that people can truly reach out to you to make sure that you're safe and that your families are safe.
Tiffany Ward, you're a different frontline worker. You're a teacher trying to make sure that our kids continue their education throughout this pandemic.
Yes, so I taught summer school, and I also taught face-to-face in the fall until November, when we had to switch to virtual. And during this entire pandemic, my focus has been for my families of my students and my students, just grace and compassion and love. And I've been focusing a lot on their social and emotional well-being, because they're, surviving a global pandemic that has shaken the world that they're just beginning to understand. I teach first grade, so I teach the smaller children. And so just trying to make sure that everyone is comfortable, and knowing that when we were face-to-face, that we could make this work by social distancing, by wearing our mask, and just following all of our safety procedures. And we made it work until the numbers pretty much rose in the city and in the state, and then we had to switch to virtual. But we're rocking it out virtual. We're making it work to the best of our ability.
Melissa Lubnow, you're over in the Lance Cruz school system, and you're a second grade teacher. How did you do all of this to make sure that the students were still learning, and you had to work with the parents, and you had to make sure that everyone was comfortable and they felt safe? It had to be a partnership.
Absolutely, yes. It comes down from our awesome administration and superintendent, trickles down into our principals and the staffing and our schools. And yes, just reassuring our parents that we have the necessary supplies and equipment to do our jobs and to keep their kids safe and healthy during this time that we are face-to-face, working as our teams in the classroom, encouraging one another, uplifting one another, motivating each other, and being flexible and creative during this pandemic.
All right, we need to take another quick little pause for the cause. We'll come right back, and we'll hear from all of you before we wrap up. Stay with us. If we as a community can thank you for what you've done on the front line of this pandemic, what's the best way?
The most important thing we can do is continue to wear a mask and social distance and mind the CDC's recommendations. That's the most important thing we can do for all of us. In addition to that, I think that, any way you can give back to community health centers like ours, Central City Integrated Health, I think that would be an amazing thing. There are many people on here that represent nonprofit organizations or organizations that reach out to the most vulnerable. And so if you can just give back, even volunteer your time to support these organizations, partnership has really been something that I've valued throughout this entire ordeal.
I think for me and, my staff, I think really it's going to be that the best thank you is going to be for people to take care of themselves, to make sure that they're wearing the masks and make sure that they're doing the social distancing. Because I think that as a healthcare professional, I'll speak for myself, I am exhausted. And so, if people were doing better at, taking this virus seriously, I think that would definitely be the greatest help. Not only to us, but certainly to the community. The virus has been a great equalizer. This has touched everyone. You may not have necessarily experienced a loss personally in your family, but I think at this point, everyone knows at least one person that has experienced a loss from this virus. And so I think, at this point, really, we just need to care for and love on each other more, and really care about our community more, and really, take seriously that, there are members of this community who are really, really struggling, and that we really need to love each other more.
We're not looking for thank yous, but, just that protection and just making sure that we are doing what we need to do to stay safe and to just minimize the spread of this virus. And so I'm sure we've all seen, whether in person or on social media, just people being out here, gathering in large groups and not taking the safety precautions. And I want to be back in my classroom with my students, and I'm looking forward to some sort of normalcy. And so I'm just hoping that that everyone could just do all of the safety precautions and procedures to make sure that we can just kind of slow this thing down and get back to what we love doing. And for me, that's teaching.
Marcus Gant, what have you learned?
I've learned how strong we all are as a society. Seeing everybody pull together really is huge. And that's the biggest takeaway, I think, is how we can all come together and be so much stronger if we all work together.
Mm-hmm. Elizabeth McLaughlin?
Yeah, I think we've learned that patients have pretty significant complications from COVID even after discharge. And so I think that's where it's really important to, I would request that everybody mask up and get your vaccine if you can, if you're able to, because I think that's the biggest way we're gonna get back to somewhat normal. And I've just really seen, all groups coming together, just like every other panelist has said. We have physicians, nurses, statisticians, everybody coming together to kind of pull things together to help us through this. And I think we're going to see more of that in the healthcare community going forward.
Rhonda Lee? I
would say I can be thanked by people believing this is a thing. Coronavirus is a thing. Mask up, get your vaccine if you're eligible. The social distance thing, stop having, a lot of people saying large groups, even small groups. If they're not your family, listen, I have moved out of the room, the marital bedroom with my wife. I sleep in a separate bedroom. That's what I'm doing. So the least that America can do is wear a mask, get your vaccine, social distance, stop having parties, stop having people over that are not part of your family. Like, if we do all those things, I think we can beat this.
I have learned that we all have to be creative and determined to work together during this hard year, just to make all of this work. It takes a village in our district and pulling together. And as far as thank yous, we don't need thank yous, but the encouraging emails from our administration, the supporting emails from our principal and the parents have been encouraging to us to stay motivated as teachers during this tough year.
Hang in there, continue to follow the CDC guidelines and whatever state recommendations there may be for social distancing, mask wearing, what everyone has really been saying. This is going to end soon, but we just need everyone to hang in there a little longer. You know, and as far as what I've learned, it's really just amazing, just the teamwork and what can get done when everyone's working together, whether it be at the hospital or the health system or communities. And we just need to continue that to push forward and get to the end of this.
Nurse Erin Dix.
I would agree with what everyone has said. I think as far as thanking us is just, you know, hang in there. We're working really hard and, you know, continue to do all the things that we need to do for each other, for our community, for our families. You know, do the masks, educate yourselves, you know, for the vaccine, you know, and if you want to get that, please do. And then as, you know, as far as what I've learned, I think I agree with, again, everything everyone has said, but the collaboration and the teamwork that we have had to be able to go in and fight this battle every day, we couldn't have done it without that. The community support, our health system support, just the support of each other and providing grace to ourselves and to everyone. I'm very thankful for that, and I've learned that that is something that I value tremendously, to be able to do something like this.
And we have such a wonderful leader, our chief. He makes sure that emotionally that we are good. And I think that's the greatest gift to all of us, is to ensure that, first of all, we're practicing self-care and safety, and that we have to be good so that others can be good. And I think one of the best things that anyone can do is to reach out of love and share acts of kindness with people around us. I think that is so genuine and so important for us today. So I think that's the biggest takeaway right now, is patience, acts of kindness, and to self-care for us, because we are in trauma. These are traumatic days for all of us as first responders. And we have to first be good within ourselves before we can do anything to help anybody else. So that's my biggest takeaway for me.
So there you have it. Brave and dedicated frontline workers, our 2020 Channel 7 Newsmaker of the Year. We thank this representative group for taking time away from their very busy schedules to share their stories and their insight. They are Michigan's true heroes. I'm Chuck Stokes. We'll be back next week with more newsmakers in the spotlight. Have a safe week.